Well, when my book comes out, and hopefully by the 4th of July, it's going to transform medicine and wellness on the planet Earth forever. Human beings 600, 1,000, 10,000 years from now will know that we have changed the realm of healing. Right now, we do not have a healthcare system. We have a disease management system. We do not have what I call life care, where we're actually putting life years back. Interesting, when I spoke the other day to Dr. Bob Dennis, who worked at NASA for years, developing the Micro-Pulse, which, by the way, if you go on our website, don't be a looky-loo. We've got a special on now, $1,000 cheaper than the SomaPulse last year, and it puts a signal in the polar magnetic signal that amplifies your stem cells 400%, which, of course, improves along with things like Indiamase. And Indiamax is a scalar transducer. It changes the biophysics of water and of the cellular membrane, so it amplifies what we call the signal-to-noise ratio in your cells. Signal-to-noise is actually the key of why Wi-Fi networks and cell phones and smart meters are bad. And there's even natural what's called geomagnetic dysphoria, where the native peoples would know not to put a community or a settlement in a particular place because they knew there was bad juju there. So I want people to understand that there's the physics and the hyperdimensional physics are all melded together. So when you're trying to get well, everybody that gets sick has three things wrong with them. Firstly, they've got deficiencies of minerals. They've got deficiencies of amino acids, which is why we have now things like our mega muscles that'll replace and put you in positive nitrogen balance. They have deficiencies of activated vitamins, which are blocked because they've got a gene snip. So even if you have an organic diet, I don't care if you have an organic diet from the Garden of Eden. If you have gene defects, you can't convert and activate those vitamins. And if you have metabolic blocks because you've absorbed toxins, you're in trouble. So to buffer that, which is why, and I remember watching a video, it was linked, I think you sent it to me many years ago, Dr. Joe. It was a lady who actually chopped a whole bunch of wood, sat up in her step on the mountains in Georgia, drank a glass of very high-proof vodka, which I'm sure would put me down on the floor probably within a matter of minutes, and smoked a cigar at 142nd birthday. Now, a lot of people say that's not possible. The oldest living person was teetering in their 113. No. There's a lot more older people than you can imagine in places that are in remote areas of China.
Right.
They're doing this, or in places like Georgia and these other mountainous areas that are getting glacial milk. So the first problem is these people don't have advanced health care. If they get crushed by a rock or get a pneumothorax or have something traumatically happen, they'll heal faster than most. But they live so long because they've got the vigor of a 20-year-old at 100. And, chopping wood at 142, drinking vodka and smoking a cigar would have put down a normal person and killed them. So you have to say, and this is the questions I ask, it's they talk about the Churchill effect. Remember, Churchill would drink quite a bit of food, eat quite a bit of food, drank every day, and smoked cigars like a smokestack. And I think he lived almost 100, didn't he? And so they say, how can this man be so healthy? And they say, well, it's the Churchill effect. Well, they looked at things like the FOXO2 genes and other genes. It turns out these FOXO2 genes, one of the primary effects they do is optimize mineralization inside the cell. Isn't that interesting?
That's the key right there for everyone.
That's the key. Isn't that quite clever? So then you have longer telomeres. And telomeres, by the way, if you have short telomeres, it means you can translate or transfer chunks of genes from one gene to another. So you get what we call heteroptopic DNA. You get gene breaks where the genes are not properly reproducing, and we call extracellular plasmids with chunks of genes that are actually replicating on their own when the materials show up. So that's bad. And what people don't realize is minerals buffer you from radiation. If you want somebody who's working in a nuclear reactor, the very most important thing they need to do is optimize their antioxidant systems like NutriDefense, goji berries that are NutriComplete, Omega Supreme Krill, NutriComplete with the goji berries, and then of course minerals. If you have optimum minerals, you're going to be able to take when a gamma ray, energy photon zips through your body, or you get a exposure to a high energy beta particle, which is electron. It produces oxidative stress. Guess what protects you the most important? It is minerals.
If you optimize from radiation, even, huh?
Yeah. So if you're trying to protect your people, besides their fancy radiation suits, you want to be doing that. Now, of course, out in the sunlight, and they just put out a report now of niacinamide, which is vitamin B3, that it protects you against skin cancer. And it turns out that they say that adequate levels of niacinamide will basically prevent or treat every kind of skin cancer. That came out in the Google News even today. What people need to realize is that those things always work with minerals. So if you don't have the adequate levels of minerals like magnesium, manganese, molybdenum, zinc, copper, and trace elements that are really unusual sounding, you can't stay well. You just can't. It's the body has to have that trace mineral to even turn on. For example, what I discovered, have you ever heard of a thing called HAPE and HAG? These are high-altitude pulmonary edema and high-altitude cerebral edema. It turns out that the same mineral that protects against those high-altitude pulmonary diseases from high-altitude climbing or living at high altitude is molybdenum. And if you want to optimize molybdenum because you're a rock climber at high altitude or you like to hang glide and you're not receiving a pressurized cabin, you need to take indium, because what it's going to do is increase the ability to produce nitric oxide so you don't develop serious pulmonary hypertension. In fact, I discovered this at the Children's Hospital Clinic in Denver, that they were trying to figure out ways to raise nitric oxide production because kids are coming, preemies are getting pulmonary hypertension and going into congestive heart failure. It turns out that molybdenum is the primary thing that will reverse it, and the primary thing that will reverse that is indium. You give indium, and all of a sudden there's enough molybdenum in their diet, they'll yank it in, put it in the right metabolic processes, and all of a sudden their nitric oxide levels come up, which means it's going to reverse hypertension. And what is hypertension? Hypertension is the compensation of your heart trying to raise systolic and diastolic pressures to push blood through blood vessels that are flaccid and not doing what's called rhythmic pulse primary peristaltic waves. So the primary wave of the heart contraction hits the blood vessels. The blood vessels respond to that pressure wave by a metabolic process to create a peristaltic wave to push the blood all the way through the body. So your heart doesn't pump the blood around your body, your blood vessels do. In fact, if you look at the right ventricle is not pointed to suck the blood back to the heart. It only pushes it toward the lungs. So if you talk to any doctor or cardiologist, if they ever consider the fact that the heart cannot pump blood back to your heart, it doesn't. It's only your blood vessels. And when it pumps it out, if you actually look at the non-Newtonian fluid dynamics, and I've actually looked at the equations myself, you can't physically generate enough pressure to push the blood through the capillary bed with even the strongest athletic heart without blood vessels having peristaltic spasms, which again is dependent on mitochondria, mitochondrial function, and oxidative metabolism. Nitric oxide is dependent on minerals. So if you've got
building blocks,
so it all comes back to these basic principles.
Not only do we have to eat, but we have to eat correctly and with the right catalysts available.
Right, and the problem is, you see, I started doing research on magnesium back in 1978 when I was a resident in family and internal medicine at the Calgary General Hospital, and I went into the library because I was getting frustrated with having people die on me. So I got magnesium sulfate that was used for toxemia pregnancy, and I started giving it by direct cardiac needle or subclavian line, and I got people back from torsade de pointe, fine ventricular fibrillation to course, so I could resuscitate them, and hypothermic cardiac arrest. And I had pulled the research from the Texas A&M, so of course I sent my data to Dr. Eisenberg at the Research Institute in the University of Washington, Seattle. And so that me, along with several other doctors doing research on this, were the cause of why magnesium's in the ACLS protocol worldwide. But other than that, every other time that I've done research, I've been persecuted for making things like magnesium as dangerous. If you want to get rid of magnesium out of your body, mercury out of your body, I worked with Dr. Murray Vimy on his PhD in dental pathology at the University of Calgary, and I was threatened by the College of Physicians and Surgeons of Alberta in 1981, working in association because I'm at an equivalent of PhD in biochemistry at 21 before I went into medicine, and they threatened me, and we now have proved, and that's why we have the IAOMT for biological dentistry, because of my research with Dr. Vimy long before Hal Huggins or anyone else. So.
Fantastic.
People need to know this is Information Central. If you're a naturopath and med, we're going to bump it up a bunch of notches, no matter what you're training or how many years of practice. If you contact me, I will train you free on any topic you want. And welcome back. And Ron, I want you to talk about the Lumen Photon. I guess since last August we've had some upgrade on the controller for the Lumen.
Yes.
It's literally one of my favorite machines for regenerating tissue and for healing, turning off inflammation. In fact, we even use it for transcranial therapy for people with post-traumatic concussions, Alzheimer's disease, chest or kidney for regeneration of tissues that they're planning a stem cell transplant. And again, I'm now recommending that what people consider is I call the power of ones: mild hyperbaric oxygen therapy or Nutrimeds, lumen photon and micropulse directly over, say, their kidneys if they're going to regenerate them, contacting Stemedica and their clinic in Santa Clarita, California, Santa Clarita, Mexico, actually, that's produced for the stem cells made in San Diego. Tell us about lumen photon. This is literally the light frequency, the frequency of life. Because when cells talk to each other and biological molecules express their vibrational frequencies, it's in the informational spectra of infrared light, far and near infrared light. So tell us a little bit about the technology and about Dr. Nogier, because we're going to have more than one segment to talk about this today.
Well, it's important that we have the most important infrared LEDs that we have. We can't buy any that are more potent than what we have. But the combination is the Nogier's frequencies. Dr. Nogier had worked with an international group of medical doctors back in the 60s in France, and they were able to prove that when mammals tissues divide and differentiate in the ovary systems, and everything comes out. Everything that's ectoderm and is skin, nerve, eyes simplified, and that's pulsing at 293, 66 cycles per second. Excuse me. Off of the schedule there, but they're pulsing at a very solid frequencies. Endoderm is the lining of the gut, all the glandular tissues, and essentially our body pulses at these normal frequencies. Dr. Bill can give us a full update on all of that, but that's really the basic. And the lights, the infrared LEDs force everything to penetrate. The LEDs will penetrate 6 inches at least into the body, and we dealt with some horses. We now have a big equestrian center here now, and it penetrates very deeply into the gut of horses that have colic, for instance. So it's penetrating much deeper in than you normally would be thinking, but it will penetrate through a cast. It's been used just about for everything in the animal world. It alkalizes the tissue whenever you use it, it alkalizes, which is another aspect. If we're talking about something, some of the diseases like cancer, which are really acidic and have to have a very acidic environment. So the lights help to alkalize those areas as well. It's good for the eyes. It's very good for the brain. At 65, I'm able to use our lights on a regular basis, make sure that my brain has enough circulation. That's number 4, and I tune the brain up itself with number 3. And I have been doing amazingly well.
Now let's go through some of the conditions that we can help.
Yeah.
Let's say that you have stage 1 cataracts.
Yes.
And you have also stage 1 glaucoma. And the research has already been done that if you use setting number 7 on your eyes, and we have people as far away just recently that purchased one of these smaller lumen pads. By the way, they're all the same power, they're just a different size pad to put over their eyes because they have an eye condition. So they're going to take our Vision Max and Can-C eye drops, cell detox glutathione and phospholipids, Neurogen and Nutrifos, and Omega Supreme Krill to regenerate the eyes. They're going to put their lumen pad with setting 7 over their eyes to reduce intraocular pressures by stimulating the healing of the canals of Schlemm at the edge of the limbus of the iris or the colored portion of their eye. And if they have any retinal inflammation in the back of the eye where they've got optic nerve head changes from glaucoma, it's going to also heal that. We have really good results on that. If you combine that with our nutraceuticals and you have the proper signal from lumen photon, they've even done studies where they've injected animals with toxic material that would make them go blind, and the lumen is 100% effective at actually rescuing them so they don't have a problem. Pretty amazing, isn't it?
Oh, it is, and it's sometimes it's still, after 15 years of doing this, it's still amazing at times. I just stop and say, it's one of those, I say, thank you again, Lord, because it's that simple to do it. And this stuff works when you would think, this looks like it could not do anything, and it doesn't. It really does work. So.
Right. Yeah.
And it's simple. It's easy to work even if you're traveling. If you have a cigarette lighter inverter in the car, you can plug this thing in and use it when you're traveling. Those are about $15. So those are just little adjunctive ideas.
Yeah, well, when people use it, here's what I find. If they've had a concussion or they got Alzheimer's or they've got a problem with a carotid artery blockage, you can put it on your neck.
Yeah.
If you've got a problem with your heart and you've got, let's say, heart failure or blocked arteries, or you've already had a stent and you don't want to get a bypass, if you've got chronic lung disease, you've got kidney dysfunction, you already have reduced kidney function, you're trying to regenerate with your stem cells. And here's a concrete example, so I'll give people a procedure. Someone contacts me and says, Dr. Deagle, I've got reducing kidney function, I've been diabetic, I have peripheral neuropathy, I've been told I have glaucoma, I've got early signs of cataracts developing in my left eye worse than my right, I've got signs of optic nerve head changes. My doctors have told me that I've got dyslipidemia and I've got a few areas that are blocked arteries. I went through a stent, let's say, last year. You know, I'm making up a case of an amalgam of different people. What do? Well, first thing I do is take their wellness medical history, get them a QRMA machine so I can analyze it, send them through functional medicine tests like the cardio ion panel, set them up so that they're going to be doing, I call it power of ones. They get a mild hyperbaric chamber. They take all our Nutrimeds in our protocol based on the QRMA test and the functional medicine lab test, which I integrate with their history. They may get a 8D LRIS, which will actually do a scan of their body. I can log on with TeamViewer 10 and actually, while they have the hydrophones on their head, I can actually scan through and cut through every organ and tissue in their body and even tell you what kind of tumor they have, whether the arteries are blocked, which pathogens are present in their gut, and even what's going on with their peripheral nerves. Okay? It tells you everything. You can do frequency matching of every disease you can imagine. I can do functional medicine testing, genetic tests. I find with gene SNPs they have, do an analysis through Prometheus of their 23andMe genetic profile, look at their organic acids with Dr. William Shaw at, say, Overland Park, Kansas, Great Plains Laboratory. And then when I put the lumen photon pad on, we call the power wands, oxygen, Nutrimeds, energetics, they say have kidney dysfunction and peripheral neuropathy. We tell them to put the pads on their feet. They're going to put setting number 7 for pain and Nico setting for regeneration of tissues. Yep. We do the same over the kidneys and over the feet, and over time, their peripheral neuropathy goes away, their kidney dysfunction goes away, and they may require a stem cell transplant because we've now sufficiently detoxed them. Yep. They'll then, we're going to keep you over for the next segment, so stay there. We then would refer them to Stemedica's clinic at Santa Clarita, Tijuana, Mexico, for the Stemedica stem cell, mesenchymal stem cell line by intravenous. They just go in, doctor does the assessment, they just get a simple intravenous, no big needles, no bone. Back to the Nutrimedical report. So when we're trying to heal people, and I mentioned this when we had our expert on, Dr. Joe Marion, what I'm trying to do is bring the best of advanced biochemistry, intermediate metabolism, and what I call plasma biophysics. Now, when I start talking about plasma biophysics of the body, everything in the body is a charged ion, positive or negative. It also is translated through the cell membranes. The cell membranes actually act as an informational, nonlinear computer in a sense. So your cell membranes, every cell in your body, is a nonlinear, stochastic, parallel processing supercomputer. Think of every cell as a supercomputer. That's pretty cool, isn't it?
Yes.
And the signal that's translated through these cell membranes has translational proteins and complexes that send the signal in to turn on and off genes. And, for example, most people think DNA is unidirectional. You have genes, they actually make a messenger RNA and proteins and so on. When, in fact, it's bidirectional. Your experiences of your cell, including the scalar signals from Wi-Fi networks and cell phones and so on, can entrain tissues so they start pulsing in the same frequency and spectra as the surrounding signal. So whether it's a Wi-Fi network, a cell phone, etc., you want to reset those tissues and you want to stimulate and increase what's called a signal-to-noise ratio. So the proper healthy signal says, hey, become a chondrocyte for your joint, become a muscle cell or a ligament, become a new refurbished brain cell, become a new liver cell if your liver's been inflamed. Turn off the inflammation. In other words, turn on the factors that allow tissue to turn it off. Every tissue has a specific carrier frequency, and we talked about this before. Dr. Nogier, who's not only a scientist, but he's also a medical intuitive, he actually intuitively knows the frequencies, and he was able to actually find them for different core tissues, mesenchyme, endoderm, ectoderm. And because of his research, he's developed basically the most advanced. There's lots of, quote, infrared light machines. You can go to Micro-ChiroPractic, which is a catalog that's in some of the airliners. Yeah. And you can buy a hairbrush that has little lumen, like pads, but they're really weak. I mean, the lumen electro LEDs are like ridiculous, but they're there to try to help you from going bald. So if you have balding, I tell people take Collagen Max, Recidival Hair Tonic, Hormone Synergy so you don't bioconvert hormones, especially in females, to male hormone, and use lumen pads on your head and put it in the Nico setting and put it on the top of the area where you're developing, I call the Kippa syndrome, or the frontal hair balding syndrome, where you're losing hair in the front or in the crown of your head, and your hair follicles start to regenerate. If you're having problems with a bone that's weak, bone density, let's say a DEXA scan showed L4 vertebrae, or the surgical neck of your right hip. I recently did a bioplasm NLS review of a gentleman, and it turned out he had some pretty significant degeneration in both hips, but particularly in the right. His older brother already has total hip replacements, and you don't want that. It's a mess. And they often don't last. They're not mechanically the same as a real hip, and you get problems, especially infections around them that can be very, very deadly. And if you have to have the appliance removed, basically you're completely immobilized for the rest of your life because you don't have a hip anymore. You can't stand. You can't even sit properly. So it's important to keep the hardware, i.e. your bones, where they are, and just regenerate them rather than rushing off to get an artificial titanium alloy new joint replacement. Let's talk about the frequencies. What frequencies did he find? And we go from number 1, which is the lowest frequency, to number 7, the highest, which is the most anti-inflammatory. The most stimulatory are the lower frequencies, like 1, 2, 3. Frequency number 1, 2, 3. Let's go through what they do in each tissue, because there's a carrier frequency for mesoderm, endoderm, and ectoderm.
Yeah, number 1 is the one sort of the pile driver. It penetrates a long wave, so it will penetrate very deeply into the body. If we've got somebody that, when we first dealt with people, in particular men who were 500 pounds and above, we found out that number 1 would help to set the work, and that would help them. Then we come back and use number 5 on there, and that combination, using 5 and 1, and we got really good results on their pain.
Right.
So, yeah.
That's interesting. Yeah. So and it penetrates as far as a foot through bone, muscle, ligament, brain, heart, with any organ. That's why it's so good even in large animals like horses. And what's interesting is, as you mentioned before, if you leave the pads on and you go to the bathroom, if you have cats or dogs or other cuddly animals, they're going to grab your pad on you, and you come back and say, "Get off! It's my turn. I want it." And the animals are, "No, I want to cuddle up to that pad," don't they?
Well, the horses, because we have there, this is a big equestrian area, a really big equestrian area, and their vets all have our equipment around here, and it's but having dealt with horses that have colic, we've seen that our lights can penetrate into their gut and get that to calm down in there for them, which was something surprising. It's not supposed to go that deep.
Yeah, well, it does actually. And the thing is, whether you're regenerating the heart muscle from congestive heart failure, or reversing colitis, or you're actually stimulating the body's immune system to go after cancer. Let's say you know where a primary is or secondaries from, say, a ATL or a S scan, or you've had a CT, spiral CT, thin section cuts, and a PET scan, so you know where the primary tumor is and secondaries. You can assist your fight if you've gone to one of these clinics like the BioCare, the Oasis of Hope, or ISIL's clinic in Mexico, by actually putting a lumen pad over the target areas of the cancer. So if you've got, a cancer that's localized to the right lobe of your chest, and you got some spread elsewhere, you can actually put the pad over, and it's going to help the body fighting the cancer as well. It basically stimulates blood flow, stimulates immune system stimulation, and increases the body's ability to fight infection and or stimulate fight to cancer. That's pretty amazing, isn't it?
And it alkalizes. It alkalizes again. That's another thing. Yeah. All that. Yeah. Too bad we can't use it in the United States. So, for that purpose.
Use what in the United States?
Huh?
Say, you're funny. Too bad you can't use what in the United States?
You can't charge for that for using it in the United States, I guess is what it would be. So.
Yeah, well, you use the pads here in the United States, but you mean you can't, you mean make the claims of what it's doing.
Oh, yeah.
Oh, yeah, of course, the United States is overregulated. Here in California, if I had a license in this state, which I don't want, if you refer for anything other than radiation chemotherapy, which is paint by numbers because it's not based on gene-based targeted therapy, and surgery, you can not only have your license taken, you could be sent to jail.
Yeah.
So that's obscene, and the medical profession should be shamed out of doing this kind of thing. And we're shaming the medical profession out of doing abortions because the Congress just passed a law against painful abortions. What people need to know is we're going to move into the 21st century into what I call real functional-based, metabolic, and plasma physics-based wellness. So whether you're recovering after surgery, let's say you have plastic surgery on your face,
Yep.
and you're a 65-year-old female, and for your birthday, you said, the family put together and said, here, Mom, go off for your $10,000 plastic surgery, and afterward, you want to, of course, be taking, and before Collagen Max, you want to be taking Lumen Photon on your face to speed the healing process and improve the amount of healing. So you get good skin retraction, good blood flow, no problems with your skin. If you're having a problem with, let's say, a shoulder capsule, and you've had shoulder surgery, post-op, you want to be using a Lumen pad. I mean, I think, to be honest with you, I can take any doctor, no matter what they are, if they're an orthopedic surgeon, abdominal surgeon, plastic surgeon, cancer doctor, and using the combination of these other therapies, what I call the Power Ones, Oxygen, Nutrimeds, scalar energetic technology like Lumen, Micropulse, and X-Vitalizer, and stem cell therapies, we can increase the extent and the amount of healing and the speed with which that healing occurs. And, of course, when you're dealing with a horse, which is an animal that might be worth up to a couple $1 million or more, the owners will go to no end to make sure their horse gets better. I mean, certain illnesses, if they get them and they don't heal it, they have to put the animal down. And you don't want to put a $2 million animal down because it's broken its leg or something. Amazing. Lumen Photon, get them here at Nutrimedical.com. We have the very best machines and technologies in the world to stimulate with the power of healing life light force. Back in a moment. Stay there. And welcome back to the Nutrimedical Report. Ron, we have a kind of an interesting thing. I want to go over some of the theories of what aging is and why Lumen is so important for anti-aging. The first thing we talked about with Joe Marion today is mineralization. We have our Trax amino acid chelated minerals in our life support, Vitamin Mineral Max and Minerals Plus, and all our other products. We have, of course, the support for detoxification with Life Support, NutriComplete, and the NutriDefense, the most powerful anhydrous catechin. Our minerals, including detoxification with cell detox, glutathione, Nutritrala, and Regenerex. We have the mitochondrial DNA repair, which includes ellagic acid, malignant block, and full vitamin K2. We have, of course, probiotics. Living Probiotic, which is Roselle 6 strain. Antipathogenics, we have the Living Probiotic Ultra, the How Are You strain, the most powerful probiotic on the planet. Antipathogenics are a monoatomic nutriodine, which is absolutely amazing. It's our most important nutraceutical. Allicin Med, which is considerably less cost than the Alamax Alamed, but 200 milligrams more power per capsule than the Alamed, which has been a major antipathogenics as a written script in Europe, Great Britain, Australia, New Zealand for over 25 years now. We have, of course, the probiotics. We have the stem cell support therapy, which, of course, includes Myco-D2, Microdose, Collagen Max, Mountain Red Velvet, basically tendon mender, joint performance for restoring and supporting stem cells. And, of course, we have the mitochondrial support nutraceuticals such as IBS Care, which is a special slow-release carnitine, the propionyl L-carnitine, which is Vascu Care, CoQ10 Supreme, the only non-crystallizing CoQ10 ubiquinol. We have mitochondrial catalyst, uridine, which is triacyl uridine, and supportive mitochondrial function. So we have everything. Now, of course, when we add all that nutraceuticals together, what the light does is it actually hits the biomolecules and increases the signal to tell the cells, hey, absorb that nutrient. So if you're trying to absorb nutrients and let's say your absorption is poor, you can put the Lumen pads directly over your stomach, and you're actually going to amplify absorption, especially for minerals, let's say in the second part of the duodenum. So let's say you've got osteoporosis. I tell people, after supper, take 3 to 6 capsules of bone generator. It's only absorbed in the second part of the duodenum, which is 10 centimeters long. And the lumen pads are directly over your upper abdomen. Turn them on the Nico setting, and you're going to start absorbing your minerals better. Let's say you have a weak vertebrae in your L4 vertebrae on your DEXA bone scan. Put the lumen pads on the Nico setting, and do that for at least an hour to 2 hours a day. And you're going to go back, if you do a repeat DEXA in 6 months to a year, you're going to see the DEXA scan improved. And also, if you're taking your nutraceuticals to reverse osteopenia, osteoporosis, the breakdown products for connective tissue called deoxypyridinium and pyridinoline collagen subunits will no longer show up in your urine. That does within 3 weeks of treatment. So lumen pads can be used for so many things. Let's say a peripheral neuropathy, plantar fasciitis, a subluxing, meniscal tear or bucket handle tear of your menisci in your knee, a retropatellar tendonitis, capsulitis of the patella behind the kneecap. I mean, there's just no end to the uses for this. Let's say you have a breakout of scleroderma, or you've got rheumatoid arthritis in joints, and you have a rheumatoid splint. The nice thing about this is it'll go right through a fracture splint. So if you broke something with a fall, like your wrist with a radial head fracture, you can put the lumen pads directly through the cast. It'll actually speed the healing, which I think is kind of cute. It's you get your cast, and the light just said, I don't care if there's a cast there. The light just whips right through it like it's nothing. And it speeds up the healing. You pop the cast on and say, my gosh, that healed fast.
And
so
one simple thing that people have our equipment or want to get rid of inflammation systemically, the C-reactive protein. This is a formal medical study that was done with 3,500 patients, went on for about 3 years, all this sort of stuff. And it was done by the faculty of Washington University Med School in St. Louis. They found out at the end of the cycle, they put it on the pad on the low back area where the adrenals are, used the Nico setting, and at the end of a 3 year test with 3,500 patients, they averaged a reduction of CRP by 89%. So
wow.
That's the one that if we could get people to do this on a regular basis, that makes everything else a little bit easier in life because inflammation is down in the body.
Well, inflammation has its place, but the inflammation should be minimized. In other words, inflammation starts the process off, but then once the cells are in place, the body should take over and say, we don't need to do that anymore. We now move to getting the stem cells in place, stimulating everything else to try to get things going, right?
Yep. That's what we can continually hear from people. Wow, I didn't expect it to do this. Yeah. Well, we don't know. It's one of those that because it's dealing with the issues.
Yeah, what's amazing to me is how we don't understand these things, that the body actually has a degree of intelligence.
Yeah.
And if we properly stimulate that intelligence, we're going to fix the problem, in other words.
Yeah, that's sort of feeds itself somehow.
Yeah, it's kind of interesting, isn't it?
It's miraculous.
Right, that's a good term, miraculous, eh?
Yeah, it is. I mean, we have come to expect it. So it's, yeah.
Yeah. So one of the things I find interesting is that when people talk about healing, they don't understand how the scalar signals are so important. That's why a lot of people like sunlight. Sunlight has a few frequencies that are going to help heal the body, but a lot of the frequencies are quite toxic now. For example, 73% of the ultraviolet light in the current sunlight is actually toxigenic. A vitamin, what's called frequency A range, which you can go through our product companies to SCMF. Frequency A stimulates tanning. B stimulates, can give you a burn, for B for burn. C will actually cause DNA damage in your skin and even activate drugs you're taking, photoactivate drugs that you're taking to make them toxic. For example, if you're taking fluoroquinolone drugs, which are a DNA gyrase 4 inhibitor. DNA gyrase, by the way, is an important enzyme for helping the manufacture of mitochondria. So if you take a DNA gyrase inhibitor, when your mitochondria start to fail in your connective tissues, your joints can fall apart and your heart muscle. Interesting, eh?
Yes.
And most people don't realize that Levaquin and moxifloxacin are DNA gyrase 4 inhibitors, and that's how they work. When you take light therapy, what you're doing is you're saying, hey, we're giving you a good signal, far and near infrared, which is the good signal, no ultraviolet light, whether it's going to tan you or not, no ultraviolet light, only the good infrared signal that's going to turn on the healing process, turn on the regenerative process, improve microcirculation. And I think people should understand if you're taking the right NutriMeds and you're putting the right signal in with micropulse and with lumen photon. And I like the lumen photon because, in fact, I actually have it on right now. I put it. The nice thing about it is you can travel with it. You can plug it in your car. You can be wearing it on your back when you're walking somewhere. If you have a little battery pack, I can put it on while I'm in the chamber, just having one of the little battery packs, and actually go in my mild hyperbaric chamber. So if I have something that I've kind of injured by doing exercises, and the way I like to exercise is quite different. I don't do what I call, what I've seen the other night on 60 Minutes, the poster child for CrossFit, which I think is a combination of aggressive and extremely stupid exercise. What you want to do is improve proprioception, and you want to improve neurological function, which is where lumen comes in. So I like to do what's called moderate weights and resistant bands on the vibrational platform. And when you do that, if you're doing a 25-pound weight, the weight actually physiologically amplifies 3.6 times, so each weight is equivalent to a physiological effect of 100 pounds without the chance of injury. Then if you do get some injury, slap a lumen pad on, take our Collagen Max, Inflamax for inflammation, cell defense, tendon emitter, joint performance, and Mountain Red Velvet, and the body says, oh, I can do this. I can heal it. You get that signal going in with the lumen pad, you get the nutrients there, the body says, signal's present, know what to do, stem cells go in there, fibroblasts generate new strengths in the connective tissues and ligaments and capsule of the shoulder, and you're set. I'll tell you, lumen photon's one of my buddies. I got my machine here all the time, and I like the dual pad, because then I can do two pads and do one area of the body or two where kind of, I call Velcro them together. I like to Velcro the little guys together, and they do a fantastic job. Lumen pad, the light therapy for healing and for life care, for stimulating regeneration, stem cell activity, circulation, detoxification. They're amazing. Thank you, Ron. Again, go through Nutrimedical.com to get the best lumen photon machines.